In this tutorial, you will learn how to scan multiple preps and a single prep with the iTero Lumina scanner. We will demonstrate 2 scanning workflows as we recognize that each patient presents their unique clinical challenges. The following case includes 3 prepared teeth in the upper arch planned for a bridge, along with 1 prepared tooth in the lower arch. The planned restorations are in direct occlusion. Since we are utilizing the streamlined workflow, we will scan in this order: full upper arch, full lower arch, bilateral bite. The scanning workflow may be different with or without the pretreatment scan. Our sample case today does not use the pretreatment workflow. In any case, the clinician can utilize the pretreatment workflow to create a copy of the existing anatomy and duplicate it or capture the temporary anatomy. Make sure the teeth are dry, the margins of the preparation are exposed, and contacts are free of debris before scanning each arch. If the system detects excessive saliva, a notification will appear. This notification is there to alert you to dry and rescan after the saliva has been removed. Please note that the saliva detection tool is disabled by default. To enable it, navigate to Scan Settings and mark the relevant checkbox. For each of the arches, scan occlusal, lingual, and buccal. Scan from posterior to anterior to enable the smooth and accurate data capture. Let's start with scanning the full upper arch. The scan of the prep is performed as part of the arch. During scanning, make sure that the real-time scan assistance tool is activated. This ensures that enough anatomy is captured in critical areas. Once the prep is ready, start scanning the occlusal of the arch. Keep scanning in a circle motion, making contact with the teeth adjacent to the preps to capture any missed areas. Tilt slightly buccal to fill in missing anatomy. Continue scanning the arch by completing the occlusal and lingual pass to make sure all critical anatomy is captured. Avoid holding the wand too parallel to the buccal surface. The iTero Lumina scanner has a wider field of capture and multi-angled scanning that enables simultaneous capture from multiple angles, making it possible to capture more dentition in a single uninterrupted movement and deliver smooth, faster, and more accurate scans. After completing the arch scan, evaluate the scan. Proceed only if the anatomy is clearly captured. If any critical areas are missing or unclear, correct them before continuing. You can erase the area and rescan to refine the preparation as needed. In this case, the preparation margin was not properly captured due to gingival bleeding. Switch to monochrome. Zoom in on the area from the occlusal point of view. Tap on the prep editor. Tap on the Select and Rescan button. Circle the prep tooth you wish to rescan. In this example, only part of the prep is selected, and rescan as the rest of the margin is clear and does not require rescanning. Make sure to rescan an area larger than you removed. This will help achieve more accurate results and fit of this segment into the arch. Tap on the rescan button and the selected surface will be erased. To capture any missing areas on the prep, indicated by dark blue, gently rock the wand buccally and lingually. To ensure proper stitching, scan an area slightly larger than the section that was removed. Verify that all dark blue areas have been captured and that all required data from the adjacent teeth has been obtained. Make sure that the area that you scan is stitched into the main arch and is not standing alone as a separated segment. Next, let's scan the lower arch. The scan of the prep is performed as part of the arch. Once the prep is ready, start scanning the occlusal of the arch. Hover over or touch the dentition to capture more buccal, lingual, and incisal anatomy. Roll lingual to fill in missing anatomy and complete the lingual pass. Tilt slightly buccal to fill in missing anatomy. Avoid holding the wand too parallel to the buccal surface. As you reach the prep tooth, look for dark blue on the prep, margin, and contact areas. To capture any missing areas on the preps indicated by dark blue, gently rock the wand buccally and lingually. Scanning the bite. Finish by scanning the bite. Turn the wand on and capture 3 to 4 teeth in a wave-like motion. Make sure not to cross the midline and then turn the wand off. Follow these same steps for the opposite side. The following steps are recommended before moving on to the post-processing phase. Review the scan to ensure all data has been captured. Review it in both color and monochrome to evaluate the quality of the prep and contacts. Once complete, move to post-processing to evaluate your scan. After the scan is processed, you may notice a color difference between the arch and the adjusted area. Remember to optimize scan capture. Use the wand tip or retraction device to stabilize the tissue while scanning. Effective tissue and fluid management is essential for clear margins. Review the model for any dark blue voids and fill them. Scanning the prep is part of the arch. While scanning the arch, add a rocking and circular motion when you reach the prep to help capture the whole margin. Make sure you captured the adjacent contacts of the prep. Scan close to the prep, touching adjacent teeth for optimal margin capture. It starts with iTero.